So if you've just gotten a positive pregnancy test and you're wondering what's happening in your body, you are at the right video here at week 4 pregnancy series. So what really is happening in your body at week 4 of pregnancy? Remember, at week 4 you've missed a period and you have confirmed that pregnancy is there by testing positive. And you've tested positive because the HCG levels have risen up after implant. They're usually high enough to be detected after implantation has taken place. And then, so we have said that the HCG is rising, and that is why you've gotten a positive test. Remember, the size of the baby in your uterus is very small, very tiny, as a poppy seed. Okay, so the only thing that we have here is a positive pregnancy test at week 4. So let's talk about baby development now that we already have implantation has taken place. So the fertilized egg, which is called a blastocyst, has implanted in your uterine lining. Okay, yeah. Then the placenta, after implantation occurs, the placenta and the umbilical cord begins to form. And then the neural tube that will, at the end of the day, will form the brain and the spinal cord, starts developing. So at the end, I'll talk about the things that you should do, including the medications that you're advised to take during this time because of this critical level of development that is happening. So common symptoms that you might experience at week 4, there are so many. So I'm just going to talk about the early symptoms that some women might experience at this week. So one, you're going to have a missed period. Okay? And then a positive pregnancy test. If you take a PT test, it's going to be there. Mild cramping. This is not severe pain, just some mild cramps. Okay, those are implantation cramps. And then some light spotting that you might experience because also of the implantation. Then breast tenderness, fatigue, frequent urination. Okay. Then we have some mild nausea, some women might experience, some food aversions. You might find yourself not really interested in the foods that you used to like most, some of them. And another thing, you might find yourself experiencing some mood swings due to hormones that are rising in your body. So a nurse tip here on the symptoms is that symptoms might vary, okay? Symptoms are not the same in all women. So some women might feel nothing, and that is completely normal. So if you feel you don't feel any of this and you find yourself you tested positive, it's completely normal because symptoms vary woman to woman. Then what do you need to do at week 4 of pregnancy? This is now the nurse's advice. Start taking prenatal vitamins, especially folic acid, because of the development that is very critical at this level if you are not taking. But if you had started them before, continue taking them. Avoid alcohol, smoking, and unnecessary medications. Please don't take any medications if they've not been prescribed for by the rightful person to do so. Drink plenty of water. Rest. When you feel tired, just rest because your body is working hard at this level. Then you should schedule your first antenatal visit. Okay? Schedule your first antenatal visit as soon as you find that you've tested positive. It's very, very important. And I think I'll make a video on the importance of antenatal visits in pregnancy. So when do you need to see a doctor urgently at this week? This is when you experience heavy bleeding, okay? Severe pain. Remember we said we are expecting mild cramps, some mild cramps, not severe pain. And then when you have dizziness or if you faint, you need to see a doctor urgently, okay? So please subscribe to Mommy Aren for these weekly pregnancy updates. I'm doing from week 1 to week 40. Please subscribe to motivate me and also to help me grow and reach as many women as possible. I'm going to give nurse tips in each and every of these videos. Remember, this is a nurse who is a mom explaining pregnancy. Thank you for watching till the end.